Hello everyone, my name is Priscilla and today I'll be presenting my literature review on the topic of safe patient handling in nursing. This review examines the current research on safe patient handling programs and their impact on caregiver health and safety in healthcare settings. Let's begin. In this presentation, I'll be discussing safe patient handling programs, which are designed to reduce musculoskeletal injuries among caregivers when they handle or move patients. The research question guiding this review is how do safe patient handling programs impact caregiver injury rates and overall health? The studies I'll discuss come from recent research conducted by Barron, Evans, and Wallen, along with additional sources that support the findings of the studies reviewed. Safe patient handling is a critical issue in nursing practice due to the high rates of musculoskeletal disorders among caregivers, often resulting from frequent lifting, moving, and repositioning patients. These injuries are not only detrimental to caregiver health, but also leads to increased absences and healthcare costs. The significance of addressing safe patient handling lies in reducing these injuries and improving both caregiver and patient outcomes. The prevalence of musculoskeletal disorders among healthcare workers is alarmingly high, with rates ranging from 30 to 60% in some studies. For this literature review, I conducted a thorough research of peer-reviewed studies using databases such as PubMed, CINAHL, and Google Scholar. The search terms used included safe patient handling, musculoskeletal injuries, and caregiver health. I focused on articles published in the last 5 years, ensuring that they were relevant to the research question. I selected 3 studies that involved different research designs, including cross-sectional surveys and qualitative interviews, and evaluated them based on their methodology and findings. The first study I reviewed was conducted by Barron, which focused on safe patient handling and mobility programs for overweight and obese patients. This was a cross-sectional survey that assessed caregiver injuries and program compliance. The study found that safe patient handling programs tailored to overweight and obese patients were effective in significantly reducing caregiver injuries, particularly musculoskeletal disorder. This study is classified as a descriptive research and is considered level 4 evidence in the hierarchy of research. The second article by Cameron Evans explored the perceptions and participation of hospital-based physical and occupational therapists in safe patient handling programs. The research design was qualitative, involving in-depth interviews and surveys. The study reviewed several barriers in safe patient care handling programs implementations, including time constraints, insufficient training, and lack of institutional support. These barriers hinder the effectiveness of safe patient handling program. This study is considered level 4 evidence and it is qualitative research study. The third study by Wallen examined the relationship between musculoskeletal disorders, work conditions, and safety climate in relation to patient care handling in healthcare settings. This study studied a cross-sectional study design similar to the first article. The findings highlighted that work conditions and safety climate significantly impact the success of safe patient care handling programs. Caregivers working in a positive safety climate were more likely to follow proper handling procedures, reducing the risk of injury. Like the first study, this study is considered level 4 evidence. When synthesizing the findings from these studies, it's clear that safe patient handling programs are effective in reducing caregiver injuries, especially when tailored to specific patient populations, like those who are overweight and obese. However, there are challenges in implementing these programs, such as lack of training, sufficient resources, and time constraints. The importance of a positive, safe climate in healthcare settings cannot be overstated, as it influences caregivers' adherence to safe patient care handling protocols. To address these issues, I recommend better training programs, adequate equipment, and institutional support. In conclusion, safe patient care handling programs are crucial in reducing caregiver injuries and improving patient outcomes. However, challenges like inadequate resources and training barriers need to be addressed for these programs to be more effective. Healthcare institutions must prioritize these programs and foster a supportive safety climate to ensure their success. Finally, thank you for listening. And here are the references for my study review. These articles provided the foundation of my literature review, and I encourage you to read them for more in-depth information on safe patient handling programs.